So I'm Esther Muriuki. I work at the University of Plymouth as a senior research fellow, and I'm also the project coordinator for the Refresh study, which is just a word we've coined from nutrition interventions for malnourished older adults in care homes. And it is funded by NIHR. Um, we're working with many other uh, bodies, but University of Plymouth is a sponsor, and the chief investigators are Professor Mary Hickson of University of Plymouth and Professor Jane Murphy, who's is working at the Adam practice in Dorset. So I'm going to tell you a little bit more about what the refresh study and what we are aiming to do, and it's where what the interventions are and what we hope to get from this study. I'll start, of course, a bit with the background, which I think most of you already know. Currently, we have more than 300,000 people living in care homes, and 80% of these people have multiple long-term conditions and complex care needs like frailty, dementia. Up to 42% of these residents are malnourished, which leads to weakness and muscle loss. And this can lead to reduced mobility and increased risk of falls. And also, this then means that they are more bedbound and have pressure sores. And this leads to infections, making them have more GP visits, more hospital appointments, and those with complications also it makes this this complex needs even more complicated for treatment, and this means that they have reduced overall quality of life and sometimes also can reduce to even loss of life. Um, She've already heard about this, but yeah, the current guidance for treating malnutrition, of course, is to use a food-based approach first. And in the care homes, we recommend that they do food fortification, which means adding increased energy and nutrient content without increasing the portion size. And the second approach, if it does not work, is uh, to use oral supplement. But we have still very high costs for treating malnutrition, costing up to 23 billion per annum. And this also includes oral supplements, which cost a lot for the NHS, and they're costing up to 19 million pounds per month in England alone. Yet we don't know how effective the orange supplements are, and there are very few studies to support, this. And also, sometimes there's a lot of wastage. Sometimes they're not liked by residents, but we don't have a lot of studies to give evidence on how effective they are, like what's the cost effectiveness of this orange supplements. And I must say that this is why one of the reasons why this study has been commissioned by the NIHR, just to investigate what, because we say that orange supplements are prescribed to people with malnutrition as a second approach, but we don't know how, like how effective they are in managing malnutrition. And even there's a systematic review that has been done, but there was very little evidence on whether they actually reduce malnutrition. The other approach is to use food-based approaches, and but we we don't know how, we don't understand how it's done, and it is always done. Sometimes we don't give training to their care home staff or the carers to do this. And of course, we've just heard from the previous speaker about all these resources that they're developing, but we don't know how effective they are when they are used in these settings in reducing malnutrition. There are some care homes that are already using this food fortification, but we don't understand how this works, and also it can be very costly for the care homes as well. So the main aim of the study then is to investigate what is the clinical and cost effectiveness of oral nutrition supplement and fortified food on quality of life and nutrition outcomes compared to routine practice in older care home residents. So we're just comparing nutrition supplements and fortified food and checking which of this has the most impact on the quality of life for residents, and we are comparing it with routine practice, which will act like a control for our study. It's a randomized control study. Yeah, in a nutshell, it's just a trial to to test which is the best approach to treating malnutrition in older adults living in care homes. This is because if we are able to manage malnutrition, then we reduce GP visits, we reduce hospital visits, we reduce mental and physical health deterioration, we reduce the care burden, and we increase independence. And also, this will help to increase appetite if we have, and overall, and we also improve the overall quality of life for the residents. So the study has three arms. The first arm is to the already so what when once the care homes join the study, we will randomly allocate them into one of three arms. The first group is the one of the groups is the orange supplements, and in this uh, arm or in this group, the residents who are recruited in a study will receive orange supplements, and of course that's on top of usual care. And in the second, in the other group, we will give them food fortification. And then the other group will continue with their routine care of managing malnutrition. And we'll do some observations and also some interviews to understand how this is how malnutrition is managed in these care homes. And then we'll compare the three groups. Uh, We are, it's a big study. It's one of its kind. It's the only large, like large study for nutrition interventions in care homes, and we're looking for 90 care homes in three sort of regions. We're looking for the Southwest, Dorset, Bath and Bristol area, and Hampshire, and also in the West Midlands, so that we have like a representation sample. We're hoping that that is going to be representative of England. And we're targeting 1,530 residents in those care homes, so at least 17 residents in each of the care home or an average. And once a care home has been randomized, then they'll be on the study for 1 year. We are currently in the first cohort of the study. We are recruiting it in three cohorts. We're in the first cohort of the study. We're looking for 30 care homes. We've already started, we've already gotten care homes for this cohort, and some of the care homes don't have the 30 yet. And we will start recruiting residents in a couple of days in these care homes. And there are other cohorts in the next year, but the study will end in December 2028. So as I've mentioned, there was going to be three arms, and we're going to provide training in each of these three arms. This training has been co-designed with stakeholders, a stakeholder advisory group, which is made of people from different disciplines. We have dietitians, we have care home managers, we have academicians we have nurses, we have different people who are involved in residents' life who have helped us to develop this trainings. And we're going to provide training for the food fortification arm and the oral supplement arm. And both those two arms are going to receive the malnutrition awareness training, which will include uh, uh, nutritional needs for older adults. We will give them training on how to identify risk malnutrition in residents. what are the risk factors. We'll also include mass screening. We'll train the carers how to do mass screening. And we also, in the food, after the malnutrition awareness training, then we will train, depending on which group they are in. For the food fortification arm, we will give them a food fortification training. And this will include what are nutrient and dense ingredients, what is person-centered nutrition. We've tried to tailor the training into dietary needs, cultural preferences, people with allergies, how do you fortify their food? And then also we will give them a recipe booklet. This recipe booklet, we've co-developed it with, we've gotten a lot of resources from the Care Home Digest that Gladys has just spoken about, and also we've drawn some of from some of the resources that Gladys has just presented about. And also we've involved the public advisory group in developing this training and helping us to come up with recipes that are culturally diverse or considers the population that live in the care homes. And the for all nutrition supplement arm is just a training to let them know how to deliver the training, when to deliver, but we are not giving any training to the routine arm to the usual care arm, because it might interfere with the study, but we will give the food fortification training to all care homes at the very end of the study, and we will give this booklets and resources at the very end of the study. And just to say, this training, we hope that is going to change. The recipes are going to change as we get data from the routine, from the care home, and we, get this data, we can be able to modify the recipe booklet so that it is as like as applicable as possible in the care home setting. The main aim of our study is to which of these methods improves the quality of life, but we also check the nutrition status, weight, food intake, activities of daily living, infection status, mortality, and the cost effectiveness. We will also do a process evaluation and a small sub-study, which I'm just going to talk about. So we will do a process evaluation just to try and understand how the intervention is working for the orange supplement and the food fortification. This is just to be able to understand what are the causal mechanisms, the contextual factors, to understand why the intervention is working or not working. And we'll do this by conducting observations of key nutrition activities. We will do interviews and focus group discussions with relatives, residents, care home staff, and other healthcare profession to just be able to understand how the intervention is working. And this process evaluation is just going to help us to refine the trial, make changes for the next cohort, and just help us to improve how the intervention is being delivered in the care homes. We also do a small study to examine what is the nutrition care of culturally diverse older adults in the care homes. And this is because, of course, the UK has a culturally and ethnically diverse aging population. And they represent, the ethnic minorities represent 4 to 5% of the population in care homes. And so we want to understand what are the barriers to including these residents from different cultural backgrounds. And this is so that we can help to optimize retention in trials. We also examine the dietary intake by conducting interviews and focus groups with residents, families, and care home staff to just try and understand what's important for these ethnic minorities, what's important to, what's important to include in their diets, and also to understand how to better recruit them in studies or in nutrition intervention studies to make sure that they are catered for in these nutrition interventions. That is things like how much the residents eat, when, what, and is it adequate, and what are barriers and facilitators to good nutrition. So we just conduct a small sub-study. Um, so we will, of course, we will get cost effectiveness of orange supplements versus fortified food. We will get evidence-based guidance on the most effective method to treat and manage malnutrition, and also understand recruitment barriers. And of course, the care homes and residents will benefit from the resources we provide, possibly improve nutrition management and quality of life for residents. And also, the care homes will get research experience, and they will get this free nutrition training that we are providing. And yeah, for this is more information about the study and how you can contact us if you want to know more about what the study is about, or if you know care homes that you think could be interested in participating. And yeah, and that is, sorry,
Thank
I
you,
ran a
Esther.
bit off time. Yeah, thank you very much. Yeah,
Thank you for that. And it's really helpful to hear about oral nutritional supplements, isn't it? And how to manage malnutrition in care homes, things that we don't really know. So we'll watch with interest
yeah,
as your project develops.
yeah.
Thank you very much for your time today.
Yeah, thank you very much. Thank you.